Hi, my name is Olivia. I'm going to go ahead and wash my hands. I'm going to be your student nurse today. I'm here to perform a cardiovascular and peripheral vascular exam, which will be hands-on and recorded. Is that okay with you?
Sure.
Perfect. Could you tell me your name and date of birth?
Debbie Lunow, August 22nd, 1967.
Perfect. I'm just going to go ahead and provide privacy. And just for your knowledge, this exam will be hands-on, so I'll be touching your chest, your neck, your arms, and your legs. Is that okay?
Sure.
Perfect. Before we get started, have you had any chest pain recently or palpitations?
No, ma'am.
What about any shortness of breath?
No.
Perfect. Any dizziness?
No, no dizziness.
Perfect. Patient is sitting upright and awake, no signs of distress. Skin is appropriate for ethnicity and grooming is intact. I'm going to go ahead and complete your vital signs. I'll do your blood pressure and your respirations, and now I'll complete your radial pulse. All right, your radial pulse was 80 beats per minute, which is just within the normal range of 60 to 100. I see you're already sitting 30 to 45 degrees, which is awesome. I'm going to go ahead and inspect your neck for jugular vein distension. Could you face that way, please? Perfect. And the other way? All right, no jugular vein distension. And I see that your skin on your face is symmetric and intact, no lesions or cuts, and no cyanosis or pallor. I'm just going to check out your precordium. Perfect. No precordial pulsations or heaves. And I'm just going to look at your rib cage. No musculoskeletal deformities seen. I'm going to go ahead and palpate your carotid arteries, okay? That's just looking at your neck. All right, no bruits. I'm going to palpate your precordium now. No pulsations or thrills. And your carotid arteries were +2 bilaterally. Have you had any tenderness in your thorax?
No.
Okay. No thoracic tenderness. I'm also going to palpate your point of maximum impulse, which is under your breast. Would you mind moving your breast for me? Just for your education, the point of maximum impulse is at the 5th intercostal space at the midclavicular line.
Oh, interesting.
So now I'm going to listen to your 5 heart sounds. So we'll start with your aortic at the right sternal border, 2nd intercostal space. Your pulmonic at the left sternal border, 2nd intercostal space. Erb's point, left sternal border, 3rd intercostal space. Tricuspid, left sternal border, 4th intercostal space. And the mitral, left midclavicular, 5th intercostal space. And now I'm going to listen to your apical pulse. Perfect. Your apical pulse was 80 beats per minute, which again was within the 60 to 100 range.
Thank you.
And it was regular rate and regular rhythm. Now I'm going to auscultate your 5 heart sounds using the bell of my stethoscope. Again, we'll start at the aortic, right sternal border, second intercostal space, the pulmonic, left sternal border, second intercostal space, Erb's point, left sternal border, third intercostal space, tricuspid, left sternal border, fourth intercostal space, and then the mitral, left midclavicular, fifth intercostal space. No murmurs. So that completes your cardiovascular exam. Do you have any questions?
No, thank you.
Perfect. I'm going to go ahead and begin your peripheral vascular exam. Before we get started, have you had any swelling or edema in your lower or upper extremities?
No.
What about any numbness or tingling?
No, ma'am.
Perfect. I'm just going to go ahead and inspect your upper extremities. Skin is warm, dry, and intact bilaterally in the upper extremities. No cyanosis or pallor. And no edema or swelling. I'm going to palpate your upper extremities using the back of my hand. Bilaterally, the skin is warm, dry, and intact. I'm now going to check your capillary refill. Capillary refill is less than 2 seconds, which is a normal finding.
Good.
I'm going to now palpate your upper peripheral pulses. We'll start with brachial, radial, and ulnar. Perfect. Upper extremity peripheral pulses are +2 bilaterally. I'm now going to inspect your lower extremities. Is it okay if I lift your blanket?
Sure.
Perfect. Bilaterally, the lower extremities, the skin is intact, symmetric, no lesions, no cyanosis or pallor is visible, and there is equal hair distribution. I'm now going to use the back of my hand again on your legs. Bilaterally, the lower extremities, the skin is warm, dry, and intact. I'm now going to check your capillary refills. I need to remove your socks. Capillary refills are less than 2 seconds, so just like your fingers, it's a normal finding.
Oh, good.
And now I'm going to palpate your pulses. So we'll start with your femoral pulse,
Okay.
your popliteal, your dorsalis pedis, and then your posterior tibialis. Lower extremity pulses, we'll do this femoral, and then this popliteal, and then the dorsalis pedis, and the posterior tibialis. Lower extremity pulses are +2 bilaterally. So that completes your peripheral vascular exam. Do you have any questions?
No, thank you so much.
Thank you. Is there anything I can do for you?
No, thank you.
Here's your call out. You just call if you need anything.
Thank you.
Thank you.